Hi, Caitlin. Thank you for your flashcard on UTIs. I'm going to be doing my case presentation on this illness. So patient EM is a 74-year-old female who's on the adult surgical floor after a hip replacement for a right hip fracture due to a fall on her icy driveway. Prior to the surgery, EM was a very healthy woman. She was active, cognitively intact, and enjoyed gardening and playing with her grandchildren. Other than mild osteoporosis, she had no medical or surgical history. Following the surgery, EM had a very difficult time getting out of bed due to poor pain control. Instead of following the guidelines for post-op indwelling catheter removal, the medical staff decided to keep the catheter in since she could not get up and would be voiding in the bed instead. A week went by, and EM's recovery continued slowly. Today, she was confused about where she was and when her husband, who had recently passed away, was coming to visit her. She also developed chills and a fever to 102 degrees Fahrenheit overnight. There were no signs or symptoms of infection at the surgical site. She has no upper respiratory infection symptoms. Her lung sounds are clear. She has no rashes and is experiencing no vomiting or diarrhea. Her abdomen is soft, although she does complain of some mild discomfort upon palpation. The rest of her vital signs are as follows. She has a heart rate of 92, her blood pressure is 114/69, her respiratory rate is 20, and she has an oxygen saturation of 99%. You also notice that the urine in her catheter bag is cloudy, and you order a urine sample to be sent for culture and urinalysis. Based on this, you presume EM has a urinary tract infection. Her symptoms that indicate this as the likely diagnosis include fever, chills, abdominal pain, and cloudy urine. Risk factors that predispose her to this infection include the presence of an indwelling catheter for an extended period of time, as well as her immobility, since she's not able to get out of bed all that much. Additionally, the fact that she's a woman predisposes her to UTIs because women have a shorter, wider urethra, which is more proximal to their anus than that of men. Singh et al. State that elderly hip fracture patients are particularly at risk for UTIs due to their age, immobility, and use of indwelling urinary catheters. The authors also state that the surgical hip repair also can cause issues with urinary retention, leaving these patients at an even higher risk. When the urine culture results, it shows colonization of E. coli, which is the most common cause of a UTI. Antibiotics that are sensitive to this bacteria are started, and the indwelling urinary catheter is removed. Physical therapy is asked to see the patient each day to encourage mobility and out-of-bed activity. All right, thank you for listening, and below are my references.